Okay, with that, I will introduce our keynote speaker, Dr. George Thibault, President Emeritus of the Josiah Macy Jr. Foundation and Daniel D. Federman Professor of Medicine and Medical Education Emeritus at Harvard Medical School. Welcome, George.
Thanks. Well, thank you for that introduction, and it's an honor to be here. This is such an important topic, clinician burnout and clinician well-being, and it is of immense importance to our healthcare systems and to the patients we serve. It is a bit daunting to be here and to be asked to give this keynote address because in this room are many people who have immersed their life in studying and working on this very important subject and are more expert in the field than I. I want to particularly acknowledge the groundbreaking work of the Action Collaborative, which you've just heard about and many of you are participating in for the past 3 years, and the leadership of Victor, Daryl Kirsch, and Tom Naska in that effort. Through the collaborative, more than 190 participating organizations have worked to raise the visibility of clinician well-being, to improve our understanding of the problem, and to begin to advance evidence-based solutions. As you learned at the request of the collaborative, a National Academy commissioned a study, a system approach to improve patient care by supporting clinician well-being. I was privileged to be on that committee, and I must say it was one of the most hardworking, well-informed, and insightful committees I've ever worked on, under the superb leadership of Chris Castle, Pascal Carrion, and study leader Laura Ayupa. We will be discussing the consensus study report, Taking Action Against Clinician Burnout, a systems approach to professional well-being, its recommendations and its implications for stakeholders throughout the meeting today. And it is not my intent in these brief remarks to try to summarize this complex and superbly written report. Rather, I want to speak to the issue of why this matters. Why should society at large, outside of our professions, not only care about this problem, but actually feel a great urgency about addressing it? First, let me start with a bit of background. The charge to the Consensus Committee included studying both clinician burnout for causality and prevention and clinician well-being to support it. The report is predominantly about burnout because there is an agreed upon definition, which is a work-related state of emotional exhaustion, depersonalization, and inefficacy. And there is a large body of literature on which to base findings and recommendations, which you know is the hallmark of an Academy's consensus report. The committee well understood that well-being is more than the absence of burnout, but felt that clinician burnout was our best current window to gain access to an understanding of the broader concept of clinician well-being, the canary in the mine, so to speak. Further, though much of the discourse about burnout has quite appropriately focused on the mismatch of demands and resources experienced by our clinicians in this increasingly complex modern healthcare system, the committee also realized there is a very important values component to burnout that has potentially profound societal implications. So if we accept the premises of the report, that burnout is real, that it has many adverse consequences, that it is prevalent across sites and professions, and is probably increasing, we still need to ask the question, why should society be concerned about it? Why is this more than just a problem of job satisfaction for a relatively high-paid health professionals? I will posit there are 3 reasons why this is an important societal issue. Number 1, we will only have an optimally functioning healthcare system that effectively serves the needs of all of our patients if all members of the system are functioning at the highest level and achieving their maximum potential. Number two, a further erosion of professionalism will undermine clinician-patient relationships and further undermine the public confidence in our institutions. And number three, a decline in humanism will diminish all health professions and contribute to a decline in humanism in our society. Let me briefly explicate each of these points to demonstrate the connection to burnout and to establish the urgency of intervening. Reason number one, we will only have an optimally functioning healthcare system that effectively serves the need of all patients if all members of this system are functioning at the highest level and realizing their full potential. There is a large body of evidence reviewed in the report that clinicians suffering from burnout are more likely to make medical errors, are more likely to communicate poorly, and are generally less productive. They therefore are contributing to poorer patient care and system underperformance. Burned out clinicians also are more likely to change jobs or leave healthcare altogether, and both phenomena incur greater expenses for the healthcare system and for society. So it is in the best interest of all healthcare organizations and the patients they serve to take action against burnout. But this obligation and opportunity is even greater than that. And here is the canary in the mine analogy. It should be the goal of all healthcare organizations to see that all clinicians, and in fact all employees, function at their highest level to realize their full potential, which is one of the definitions of well-being. Though we lacked evidence at this time, we believe that the steps recommended to treat, mitigate, and prevent burnout will in fact improve the well-being and improve performance of all working in the system. This is an aspiration, but it is not unreasonable to conjecture that rebalancing work demand and resources, involving clinicians in system redesign decisions, improving the climate for collaboration and teamwork, aligning organizational and professional values, reducing administrative burden, improving the clinical relevance of technology support, to name just a few of the organization and cultural changes that are recommended in the report to address burnout, would benefit all clinicians and optimize performance of the healthcare system. Patients and society at large will be the beneficiaries. That's why we should care about whether we were taking more actions more urgently against burnout. As we wrote in the report, quote, the identification of interventions aimed at tackling the critical factors contributing to burnout is a way of fostering an improved state of professional well-being while improving patient care. So to conclude this point, taking action against burnout will improve patient care. Reason number two, a further erosion of professionalism will undermine clinician-patient relationships and further undermine the public's confidence in our institutions. There is a complex relationship between professionalism and burnout. There is good evidence that both real and perceived breaches in professionalism contribute to burnout. When lapses of professionalism, professional behavior are tolerated, or worse yet, encouraged, or even required, clinicians feel a sense of moral distress that accumulates over time. Some have called this death by 1,000 cuts. When organizational values do not appear to be aligned with long-held professional values, burnout is more common. There is also good evidence, going the other way, that burnout causes a decline in the professionalism of both learners and clinicians. The fact that this can occur at the earliest stages of training makes it all the more important to address this urgently. Professionalism is the basis of the clinician's special relationship with patients and society, that we will always put their interests above our own. Professionalism is the expression of our social contract to put patients' interests above our own, and in addition, to advance the knowledge in our field and pass it on to the next generation. That is the basis of the trust that leads to the most effective care. Loss of professionalism will undermine the clinician-patient relations with a resulting loss in that trust. It will also undermine public trust in the health professions, promoting cynicism that the health professions, like many other societal institutions today, are not to be trusted. So it is in our patients' and society's interests that we identify and root out anti-professionalism that leads to burnout, and that we prevent the burnout that further erodes professional behavior. This is also a powerful reason to focus on the learning environments where the earliest imprinting occurs. Studies show that burnout is prevalent among our learners, and burned out learners are more likely to display unprofessional conduct, are less likely to hold altruistic views, and are less empathetic. We need more longitudinal studies to determine the long-term effects of this deficiency in professional development of learners due to burnout. But even without such studies, we can agree that at best it represents a lost educational opportunity, and at worst it could result in a long-term deficiency in professionalism. So to conclude point number 2, taking action to improve both the working environments and the learning environments to address burnout will preserve and enhance professionalism. Reason number 3, a decline in humanism will diminish all health professions and contribute to a decline of humanism in society. Healthcare organizations that create environments in which burnout of learners and clinicians is prevalent are not humanistic organizations. Humanism, that is, making human interests, values, and dignity the guiding philosophy of the system, should be the touchstone of our education and care systems. Workers and learners in non-humanistic organizations, whether they are burned out or not, will less likely be humanistic if humanism has not been modeled or demonstrated in their learning and work environments. How learners and clinicians are treated reflects the values of the system and directly influences whether they will be humanists in practice. Health professionals, in deriving their professional goals and actions from the needs of patients, should be models of humanism in society and advocates for humanistic policies. Burned out learners and clinicians are less able to be humanistic, and systems that produce them are less likely to be models of humanism. Society loses doubly. Each individual counter with the healthcare system is less likely to be humanistic, and a major voice for advocacy for humanism in medicine and in society will be diminished. This seems to me to be even more important than ever today, when the dehumanizing forces in medicine are even stronger, and when society-wide anti-humanistic behaviors and policies are more prevalent. The work to humanize medicine follows the principles of humanism, putting patients at the center of focus, promoting a better understanding of the human experience of both patients and clinicians, deriving professional goals and actions from the real needs of patients, applying reason to better solve the problems in healthcare, and using science to devise better ways to help patients maintain health. So to conclude point number 3, taking actions that reduce burnout will help preserve humanism as a guiding philosophy for healthcare and enhance the status of health professionals as advocates for humanism in medicine society. So let me repeat the three premises. We will only have an optimally functioning healthcare system that effectively serves the needs of patients if all members of the system are functioning at the highest level and achieving their maximum potential. Number two, a further erosion of professionalism will undermine patient-clinician relationships and further undermine public confidence in our institutions. And number three, a decline in humanism will diminish all the health professions and contribute to a decline in humanism in society. So what is at stake if we do nothing to address the issue of clinician burnout? Only quality of care, professionalism, humanism. This is much bigger than an individual professional or an individual professional. That is why there is urgency to address the issue of burnout in health professional clinicians and learners. As you listen to the presentations today and participate in the discussions, please also think about some of the principles that guided the committee in its work. Number one, burnout is multifaceted and a complex problem that can only be addressed with a systems approach. Leadership from the top is essential, but frontline engagement is equally essential. Number two, strategies to address individual well-being are necessary but not sufficient. Number three, burnout is an issue across the professions and should be approached interprofessionally. Though some issues will likely be profession-specific, many, I would say most, will benefit from an interprofessional perspective. This approach will also have other dividends for healthcare systems. Number four, burnout must be approached scientifically with data, analysis, rigorous research, and feedback in an iterative way. And number five, always return to the patient. The values, interests, and dignity of the human at the center. Ask what's best for the patient in making the decisions about the system redesign needed. In conclusion, let me once again thank the committee and staff that I was privileged to work with us on the report and from whom you will be learning in the rest of today's meeting. I learned a tremendous amount from them, and I know you will too. Let me also thank the Action Collaborative and all who are attending this meeting for helping to raise awareness and create a broad community to address this important problem. Taking action will require all of you and more. My hope is that we will leave here today even better informed and with a heightened commitment to take action, that you will be activated to address burnout in order to improve care for our patients, to preserve professionalism, and to promote humanism. Thank you.